But the problem is, we have exactly the same problem in academia and in medicine. And in this environment, it costs lives. So this is a drug called reboxetine, and this is a drug that I myself have prescribed. It's an antidepressant. And I'm a very nerdy doctor, so I read all of the studies that I could on this drug. I read the one study that was published that showed that reboxetine was better than placebo, and I read the other 3 studies that were published that showed that reboxetine was just as good as any other antidepressant. And because this patient hadn't done well on those other antidepressants, I thought, well, reboxetine's just as good. It's one to try. But it turned out that I was misled. In fact, 7 trials were conducted comparing reboxetine against a dummy placebo sugar pill. 1 of them was positive, and that was published, but 6 of them were negative, and they were left unpublished. 3 trials were published comparing reboxetine against other antidepressants, in which reboxetine was just as good, and they were published, but 3 times as many patients' worth of data was collected, which showed that reboxetine was worse than those other treatments, and those trials were not published. I felt misled. Now, you might say, well, that's an extreme and unusual example, and I wouldn't want to be guilty of the same kind of cherry-picking and selective referencing that I'm accusing other people of. But it turns out that this phenomenon of publication bias has actually been very, very well studied. So here is one example of how you approach it. The classic model is you get a bunch of studies where you know that they've been conducted and completed, and then you go and see if they've been published anywhere in the academic literature. So this took all of the trials that had ever been conducted on antidepressants that were approved over a 15-year period by the FDA. They took all of the trials which were submitted to the FDA as part of the approval package. So that's not all of the trials that were ever conducted on these drugs, because we can never know if we have those, but it is the ones that were conducted in order to get the marketing authorization. And then they went to see if these trials had been published in the peer-reviewed academic literature. And this is what they found. It was pretty much a 50-50 split. Half of these trials were positive, half of them were negative, in reality. But when they went to look for these trials in the peer-reviewed academic literature, what they found was a very different picture. Only 3 of the negative trials were published, but all but 1 of the positive trials were published. Now, if we just flick back and forth between those 2, you can see what a staggering difference there was between reality and what doctors, patients, commissioners of health services, and academics were able to see in the peer-reviewed academic literature. We were misled. And this is a systematic flaw in the core of medicine. In fact, there have been so many studies conducted on publication bias now, over 100, that they've been collected in a systematic review, published in 2010, that took every single study on publication bias that they could find. Publication bias affects every field of medicine. About half of all trials, on average, go missing in action, and we know that positive findings are around twice as likely to be published as negative findings. This is a cancer at the core of evidence-based medicine. If I flipped a coin 100 times, but then withheld the results from you from half of those tosses, I could make it look as if I had a coin that always came up heads. But that wouldn't mean that I had a 2-headed coin. That would mean that I was a chancer, and you were an idiot for letting me get away with it. But this is exactly what we blindly tolerate in the whole of evidence-based medicine. This is a disaster. We cannot know the true effects of the medicines that we prescribe if we do not have access to all of the information. And this is not a difficult problem to fix. We need to force people to publish all trials conducted in humans, including the older trials, because the FDA Amendment Act only asks that you publish the trials conducted after 2008, and I don't know what world it is in which we're only practicing medicine on the basis of trials that completed in the past 2 years. We need to publish all trials in humans, including the older trials, for all drugs in current use. And you need to tell everyone you know that this is a problem and that it has not been fixed. Thank you very much.